If you're a clinician today, you know this better than anyone. You're under an absolutely incredible amount of pressure. It feels like it's coming from every direction, right? Financially, administratively. It's creating a real crisis for modern medicine. So let's just start with a number, negative 33%. What is that? Well, that's the drop in inflation-adjusted Medicare payment rates over the last 25 years. It's staggering. Put simply, you're being asked to do so much more for so much less. And at the very same time, the system is just hemorrhaging money. $266 billion. That's the annual cost of administrative waste in U.S. healthcare. And that crushing weight, well, it falls right on the shoulders of your practice.
So you've got falling reimbursements and skyrocketing costs. So where's the breaking point? Where does all this pressure actually show up in your day-to-day work?
It's right here. The endless, time-sucking task of documentation. It's become the single biggest bottleneck. Really, it's the critical point of failure in the whole system. And think about this for a second. Nearly 2/3 of all medical coding errors, the very errors that directly hit your bottom line, they all trace back to one thing: problems in your documentation. This really gets to the heart of the frustration. We call it the do the work, miss the code paradox. You're delivering amazing, complex care every single day. But if the paperwork can't keep up, you're just not getting paid for the work you've already done. And the scale of this problem, it's just massive. $4.6 billion. That's the estimated annual lost revenue for providers in the US, all because of these documentation failures and undercoding. And it's not just one problem, it's this devastating chain reaction. Nearly 1 in 5 of your claims get denied, and then it costs about $25 a pop just to try and rework them. But the really shocking part? Most of that recoverable money, it just gets abandoned, left on the table. But the stakes couldn't possibly be higher. This isn't just about a financial leak. Poor documentation is a massive legal liability. It more than doubles your risk in a malpractice scenario. That's terrifying. Okay, so that's the crisis. But what if we could flip this whole thing on its head? What if your notes could become your greatest asset instead of your biggest headache? The solution here isn't just another tool, it's a totally new kind of partner. Imagine a digital twin. It's a custom-built AI that learns to think and reason just like you. It's not just about what you know, it's about how you think, your unique clinical logic, your sentiment, everything that makes you, you. And it works as this two-part defense system for your practice. On the front end, it makes sure every bit of value from a patient encounter gets captured. And on the back end, an audit risk agent scans every single note for compliance before it ever gets submitted. The result is what we call bulletproof notes, documentation that actually works for you. It defends your revenue, lowers your risk, and finally frees you from that constant administrative grind. And the results? They really do speak for themselves. This tech can slash preventable claim denials by a staggering 80%. Just think about what that does for the health of your practice. The financial impact is pretty immediate, and it's significant. In one case, a practice saw a 15% jump in total revenue in just the first 4 months. And maybe the most important thing of all, it gives you back your most valuable resource, your time. Clinicians are seeing a 30% drop in administrative work. That's more time to focus on your patients. So I'll just leave you with this question. What could you really do for your practice, for your patients, and, for yourself if you had a partner that didn't just do the work, but truly understood the way you think?